Okay, this video is how to improve blood flow. Chapter 7 is called Waterloo. Chapter 8 is popular diets. It's going to be mostly Chapter 8. It's from this same book called A Tale of Two Toes and a Hot Tub. And the subtitle is How to Improve Blood Flow. I just call it How to Improve Blood Flow on YouTube because that's easier to follow. And also, I got some illustrations that I added in for these YouTube talks, and I ad-lib a little bit, but I didn't have illustration ability at the time I made the book. So anyways, here it is. So chapter 7, Waterloo with Jazz and Betty the Beach lifeguard. So she's a lifeguard at the beach, Betty, and Jazz is Jonathan Swift, who like the lead character of the book, and he likes her, wants to go out with her, but she hasn't made up her mind yet about him. So he's at the beach, and Jazz says, "Hi, Betty." She says, "Hi, Jazz." And now her mother has lupus, and he's just been, in the previous chapter, talking with the expert, Abelard, about lupus so he could get some useful information to share with Betty. And so he says, "I was reading about leaky gut and lupus. If your mom becomes a vegan, that might help her." And Betty says, "We already know about that." Jazz goes, "Oh." And then Betty says, "What is wrong with your feet? Your toes are red and disgusting. You're grossing me out." Jazz, "I'll see you later." So he's got athlete's foot, and that's part of the story of the book, is that they both like a different girl, and he's got to get his athlete feet healed up, and the other guy's got a problem with his diabetic foot. Okay, so now we're in chapter 8. This is popular diets, a comparison. So Jonathan, athlete Swiftfoot, Jazz, his friend Abelard Aristotle, asks him, "How did it go with Betty?" Jazz, "She saw my foot and she freaked out." Abelard, "Well, did you go to the podiatrist?" Jazz, "He gave me a big speech about blood flow being the river of life." Abelard, "Are you following his advice?" Jazz, "Yes, and my foot's starting to improve, but I need to eat more salads, get more sunshine." AA, "Sounds good." Jazz, "I want to become a vegan, but I need to learn more about the different types of diets." AA, "Well, you've obviously come to the right place." So he's named Aristotle because Aristotle was famous for wanting to classify all kinds of information and talking a long time about different things. So AA says, Dr. McDougall says that a low-carb diet is the make-yourself-sick diet. So Jazz says, "Well, what's good about the low-carb diet?" AA, "It avoids simple sugars like fructose. It avoids processed food. Medically, it has been used for treating refractory epilepsy. There's a guy at Harvard, a psychiatrist by the name of Chris Palmer, who promotes it. And there's also this other doctor by the name of Eric Westman, who they're probably the two most famous doctors that promote the ketogenic diet. There's other ones who promote it. The real ketogenic diet is much higher in fat than most people realize. Long term, the excessive amount of fat is really difficult to sustain." The vegan diet is easy to sustain long term, and all around, most populations in the world traditionally ate a predominantly plant-based diet for thousands of years. Meat is relatively difficult to obtain and it's expensive, but starch is cheap. Okay, so Jazz asks him, "Well, what's bad about the low-carb diet?" So AA says, "Well, it's high in fat, especially saturated fat that's associated with atherosclerosis. It's high in animal protein that's associated with increased risk of cancer." And Jazz, "Well, I heard that the low-carb diet helps people lose weight." AA, "Well, the Atkins diet and other low-carb diets can help a person lose weight in the short term, and they especially lose water weight initially, but long term it's not good. They tend to not be able to sustain it, and they tend to end up with a mixed diet and bad habits, and they end up gaining weight or at least not losing any significant amount of weight long term. And eventually they sort of drift back into their old habits typically." Jazz, "Well, what about the lack of fiber?" Yeah, AA, "The lack of fiber leads to constipation. It can cause abdominal pressure syndrome with hemorrhoids, hernias, hiatal hernia, the stomach popping into the chest, gastroesophageal reflux, increased risk of abdominal pressure syndrome of varicose veins, diverticulosis, and even appendicitis." Jazz, "Well, the low-carb proponents say that saturated fat is okay." AA, "No, it's not. There's a mountain of data on saturated fat that it increases LDL cholesterol, causes the red blood cells to sludge together into a rouleau formation, it increases blood pressure, it increases atherosclerosis, it also over time stiffens red blood cell plasma membranes because the saturated fats interdigitate with each other because there's no double bonds Excess saturated fat can also cause mitochondrial dysfunction with reversal of electron transport, leading to insulin resistance and prediabetes, then diabetes. Chronic insulin inhibition also will, of course, then keep on going to hyperglycemia, fasting initially, then also, postprandial initially, and then also fasting, and have increased risk of dementia. Jazz. Well, the low-carb lecturers say that sat fat is making a comeback in popularity. AA, don't let anybody fool you. Sat fat is as dead as a doornail. And that's a parody of the line from Charles Dickens in the Christmas Carol book. Okay, now we're going to talk a little bit about Dr. Kempner. Dr. Kempner was the great genius doctor. Dr. McDougall said he might be the greatest doctor who ever lived. I've read his biography, and I've read his own research and stuff, and I'm very impressed by this guy, Dr. Kempner. I do think he was a genius as well. The patients used to come to the Rice House in Durham, North Carolina, Duke Hospital, and they would weigh in on a scale. They had public morning weigh-ins at the Rice House, and they'd have their pictures on the wall, the centenarians. Those are the people who lost, the centurions, the people who lost over 100 pounds. They'd have their blood pressures posted on the wall. So there was peer pressure. It was a public event. That's a big motivator. Their food would be on the table nearby, rice food and some fruit. And he had lots of patients that lost over 100 pounds of weight. Kempner recorded the eye grounds, the examination of the retina, and he photographed them, and he had incredible findings. He had patients with hypertensive retinopathy, diabetic retinopathy that reversed their findings, which was rather extraordinary. He ended up seeing around like 19,000 patients. He also had chest x-rays of his patients who you would even see their heart decreasing in size as they became less fluid overloaded from their diabetes, less obese, and some even appeared to have, improvement in their cardiac function, a partial reversal of congestive heart failure type of pattern. Like here's a patient who lost from 400 pounds, went down to 220 pounds. Okay, lost almost 200 pounds of weight. Blood pressure goes from 200 systolic to normalize, basically close to normalize at 130. So Kempner had lots and lots of cases like this, rather extraordinary. Oh, Kempner was also kind of a rock star. He was a multi-millionaire. People from all over the world were coming into North Carolina. Allegedly, he had a bunch of girlfriends in separate houses, and then he got in trouble. One lady claimed that he whipped her. I don't even know if it's true. His biographer didn't seem to think it was true, but he led a very extraordinary life. Okay, so comparing these diets, a few questions. What about other diets? Some diets count calories. That's a pain in the butt. You don't have to count calories with a plant-based diet. You just eat the right food and your weight will move towards optimal. Of the vegetarian diets, the Kempner diet's the most strict. Initially, it started out being primarily only rice, water, fruits. If people needed extra calories, he would just give them sucrose, table sugar. Later on, he let them add in a few things, including some vegetables. Some of the other diets, we're going to go through all these, but the Spartan vegan diet is, my diet, Peter Rogers' diet. And I'm different in the sense compared to these guys that I think more about the brain, which leads me to focus a little bit also on being pretty careful about minimizing sodium. I don't like any of these processed food stuff, MSG, MFG, aspartame, the herbicides and pesticides and non-organic food. I only eat organic because of those concerns. I filter all my water. Okay, Esselstyn diet is next strict after, Kempner's and my diet. He's very precise about no oil, not one drop, no meat, not one bite. He also recommends no nuts, no sweets. We're going to go through all these in more detail. This is just sort of an intro overview. McDougall diet, also 100% plant-based. He allows a little sodium and some simple sugars because he knows that he gets better compliance. Patients are more likely to follow it. And just the big switch from animal foods to plant foods yields the most benefit for the patient. Dr. Neil Bernard, he's also 100% plant-based. The Ornish diet, last time I checked, allowed some animal products. I'm not sure if it does anymore. High-fat vegan diets encourage nuts, seeds, avocados, olive oil, omega-3. So that's actually a very popular thing, but I don't agree with it. There's some very popular, famous nutrition experts that do encourage these things: nuts, seeds, avocados, olive oil, and omega-3. I don't agree with it. I don't think these things are good fats. I'm not going to get into it too much, but I'm just letting you know I like low fat. As a matter of fact, very low fat. Okay, comparison of diets some more. Kempner's diet is sort of a 95-5, meaning 90% carbohydrate, 5% protein, 5% fat. It was actually 4.4% protein, really, really low in protein. It's actually even a little lower than that in fat. The Barbara Newborg biography of him was quite good. Kempner had incredibly good results, you know. And see, people say, oh, you got to cut down on your carbs, you're diabetic. That's nonsense. Kempner had fantastic results treating his type 2 diabetics, and he's feeding them a diet of almost 95% carbohydrates, certainly over 90% carbohydrates. That's extraordinary. Severe salt restriction. He would even get their salt time sometimes down low, around 100 milligrams per day. Incredibly low sodium. He had to follow them closely. He monitored them just because every once in a while he'd get a patient who had problems with that. And he was also taking care of some very sick patients, including ones with full-blown kidney failure. There was no dialysis back in those days, so either Kempner's diet worked or they die. People would, again, come in from all over the place to have a chance to be supervised by Dr. Kempner. It was their chance to live. Before that, in those days, a person with advanced kidney failure would die pretty soon. Same thing with advanced malignant hypertension, systolics in the mid-200s. And Kempner got a lot of those patients to come back down to normal. Kempner's diet was also often called the rice diet. He used white rice because it tasted better. It was more available. He would rinse it to get any possible sodium off of it. He wanted to reduce protein intake to protect the kidneys. Kidneys' main job is to excrete nitrogen, which comes from protein. There is no nitrogen in carbohydrates and fats. So by minimizing their dietary protein, Kempner was making life easy for the kidneys to help their kidneys recover. If you can get the amount of daily dietary protein below what the kidneys can handle, they can start catching up with their backlog of nitrogen excretion that's progressively ruining them. Also, by minimizing sodium, you get better perfusion, better blood flow to the kidneys, and that also provides better kidney function. And there's less hypertension, etc. Kempner had great, like I said, results for blood pressure, diabetes, kidney failure. And Kempner even collected all these EKGs and showed many of them reversing their previously abnormal EKGs where they had findings of ischemia. There's some papers listed here if anybody's curious, if they want to read more about Kempner. I have other videos that go into more detail about Kempner. Dr. McDougall has Kempner's entire research stuff at his website that is rather good. I've gone through that. Just to give you a little sense of foods, in general, animal foods are kind of all the same. They're basically animal protein and animal fat, which means primarily saturated fat, and they're all pretty much the same. Animal food means animal muscle. Other than dairy, animal food means animal muscle, okay? And that's going to be protein and fat with zero carbohydrate. The only animal food with carbohydrate is milk, okay? So basically, a typical food would be salmon, okay? 50% calories from fat, 50% from protein. That's a terrible food. Remember, I want my percent of calories from fat and from protein to be less than 10%. How are you going to get that with a food that's 50-50? And then if you go, well, I'll have chicken and I'll get lean chicken. The leanest chicken is about 25% fat. Great. Well, then you got 75% animal protein, which is a major cancer promoter. You can't win with animal food. The closer you look at it, the more you'll see. You study it. Animal food is just bad for health. And that's why Dr. McDougall calls it a major poison. It's bad for health. I eat zero animal food for good reason because I've studied it. Okay, these are some starches, potatoes, white rice, sweet potatoes are all around 1% fat. That's fantastic. That'll keep you skinny. They're also quite low in protein. You know, depending on what you read, a potato is about 6 to 9% fat. Rice, you know, at the Kempner diet, they said their rice, Nealon said their rice was about 5%. I eat a rice that's about 5% the last time I read it. But other rices, I'd say on average, though, once I looked at it, somebody pointed out to me, white rice on average is probably more like around 7.5% of the calories from protein. I used to think it was only 5%, but I've learned that it's a little higher than that. What else? Sweet potatoes are about 4.5% of the calories from protein. So those are fantastic food. I think those are like the 3 best foods in the world. Potatoes, white rice, and sweet potatoes. Oatmeal is a little higher in fat, around 15% fat. It's still a very good food. It's a little bit, you know, moderately high in protein at 12 as a grain. Quinoa is a touch higher in protein. Beans are really high in protein. Beans are, you know, in the ballpark, 25 to 30% calories from protein is pretty typical. Soy, in my opinion, is sort of the worst in terms of fat. It's got like 37% of the calories from fat. I don't like that. The next fattest bean is like garbanzo beans. Chickpeas are about 13% fat. Whereas you look at a typical fruit, look at his apple, hardly any fat, hardly any protein. That's exactly what you want. Tons of carbohydrate. Okay, now we're going to talk about sort of the diet I recommend, the Spartan vegan diet. And I have a separate entire video going into more detail about it. There's actually not much to say about it, but that's the Spartan vegan, which sort of fits my view of nutrition. I'm very simple. I like to keep life simple because then I got more time for other things. And also, you know, I'm former my background as a college wrestler, so I like this sort of mentally tough attitude. I've seen a lot of people, high achievers, they kind of simplify their life, just focus on a few things. If you try to do too many things, you can't do as much. All right, so what's the Spartan vegan diet all about? Very low in fat, low in sodium, whole foods only, 100% plant foods, also 100% organic. I'm that way. A lot of people don't think organic matters that much, and certainly switching from animal food to plant food is the most important thing, but I like to try to eat 100% organic, and I do just because I've read quite a bit. There's entire books on the herbicides and pesticides in non-organic food. I've read them, and in my opinion, they're significant. I don't want that stuff. Also, by eating only whole plant foods, I'm avoiding all this processed food stuff. I don't eat any. The only processed food I would eat would be plain oatmeal and quinoa because they have a single ingredient. They're minimally processed. If there's more than one ingredient, then most oatmeals I saw with more than one ingredient contain MSG or MFG, manufactured free glutamate. I wouldn't eat anything with aspartame. I don't like any of this artificial stuff. Okay, raw fruits, I like them. You know, examples would be blueberries, bananas, pears, oranges, apples, watermelon, cantaloupe. Okay, raw veggies, you know, carrots, salads, romaine, spring mix, arugulas. Occasionally, I'll eat cauliflower, broccoli, or cucumber if it's available, but somebody else will have to cook it. And I've got people who sometimes cook for me. Starches, potatoes, sweet potatoes, rice, beans, oatmeal, quinoa. You know, they're really easy to make. All you do is boil water. So these are pretty easy to eat. No meat, not one bite. No oil, not one drop. No sweets, no alcohol, no caffeine, no nuts. I mean, you can have 1 tablespoonful on a holiday, but you don't need them. In general, you avoid them. It'll help you lose weight. You got to be careful with Brazil nuts. I know some people were taking Brazil nuts every day, and that's a dangerous thing to do because they're very high in selenium. Benefits of this diet, it's real easy to make. It's nice to have an Instapot pressure cooker, especially for making rice. It tastes good. I'm real happy with it. It's fast to make, fast to clean up. It's cheap. If you want fancier meals with all the flavorings and stuff, then go to some of these vegan sites or Chef AJ. She knows all that stuff. Let's see what else. If you read like Ruth Hydrich too, she's kind of moved towards eating a raw diet. It's fast. It's fast to make, fast to clean up. You don't have to cook. If I was rich and had unlimited time, I would eat more fruits. But fruits, they're kind of expensive. They don't store very long. If you live in a cold area, they're not as available. But I think they're better than is widely recognized. Oh, I just included this picture of myself in the magic bathroom, and basically the joke of it would be if you asked, like, my wife's relatives, if they know me, they'd go, oh, yeah, he's that autistic guy who ruined the bathroom. All right, so here's the Spartan vegan diet. A little bit about nutrition numbers. Now, you look at something like a blueberry, it's a great fruit. It's going to have, I got the sodium here, but I think I forgot to put the potassium. Potassium's way high in these fruits and really low sodium. It's perfect. Exactly what you want. Okay. Salads. Okay, salads, these veggies got more protein than you think, but they got hardly any calories, so it's really pretty much of a non-issue. We talked about potatoes being great. Beans, great. Rice. So the daily totals of the Spartan vegan diet is you're looking at about 10 to 11% of the calories from protein. Most of the calories by far from carbohydrate. And why is the protein that high? Probably because I'm eating a little more beans than I would want to. They're just so conveniently available for me. But I'm getting in the habit of eating more and more bananas, and I'm reducing my beans because I want to get this number even lower. That's sort of a fine point. I think it's an excellent diet, but as a fine point, that's something I want to do because I'm trying to go for the absolute possible best. I'm not just trying to be okay or good. I want whatever I can do that's best. Okay, now we're going to talk about Caldwell Esselstyn, and this is a picture, one of my kids drew this. Caldwell Esselstyn, he's kind of like an Old Testament god, you know, this real tall, proper guy, and that's his son, Rip, and so it's sort of like the creation scene from the creation painting by Michelangelo. I wrote a book called The Vegan Reformation years ago. Oh, and then Esselstyn had patients that as their coronary artery disease did the blood flow to the Johnson often improve. So this is just a joke of a picture with, the raising of the dead. This is the raising of Lazarus. His Johnson came back to life. Okay, here's some more popular diets comparison. Esselstyn's diet's about 90-10-10. And that's 90% carbohydrate, 10% protein, 10% fats, 100% plants. And it's great for middle-aged men, postmenopausal women, really for anybody. And it just keeps your arteries open. That's what you want. Any part of your body is going to work better if it has open arteries. And you don't get atherosclerosis with this diet. And there's no other diet. Nobody's got the data Esselstyn has to show that he's reversed coronary artery disease and is able to prevent coronary artery disease. It also is really good for, all these health problems tend to come together. Minimizing your risk of diabetes, improving blood pressure. So Caldwell Esselstyn and the Esselstyn diet, he's got the best results of anyone in the entire world. So if somebody's worried about heart disease, I recommend the Esselstyn diet. And like I said, Kempner is more restrictive. So is my Spartan vegan diet. They're more restrictive than Esselstyn is. Esselstyn of late has talked, now I've heard some people say he's recommended flax. I don't know about that. And he's also recommending eat more greens all through the day. I don't know about that. I actually went and trained with him out in Cleveland years ago. And I read his books and his papers. I don't recall him talking that much about eating greens all day or eating any flax. Those are new things. I don't know if that's such a great thing. I don't know. That's sort of a new thing. Okay, McDougall, Dr. McDougall, he's a little more lenient than Esselstyn on nuts, but not by much. McDougall jokes that the reason nuts have a shell, there's a good reason why nuts have a shell on them. I think McDougall is a great nutrition doctor to study because, Esselstyn's the best in the world for prevention of coronary artery disease, but he's a little bit of a one-trick pony. He mostly focuses on let's prevent heart disease. That was his big legacy, and he deserves Nobel Prize, but he'll never get it. And he'll never even get in that. He's not even in any of the books. That's what I think is funny. You won't find. So here's these guys, Esselstyn and McDougall, have done so much great stuff in Ornish for the nutrition world and for health. None of them are in the mainstream textbooks. Not a single one of them. McDougall is a little more lenient. I talked about that on nuts. Again, it's 100% plant-based. That's really kind of a dividing line to be 100% plant-based. I actually think that's an important dividing line. There's a big step psychologically, physically, when you go 100% plant-based. You're not BSing around. You're not an alcoholic who has a drink once in a while. You're not a smoker or former smoker who smokes once in a while. No, zero animal foods. I think that is by far the best way to go. McDougall does allow a little nuts and sugar. A little sugar and salt for his patients to put on their food because he says it gets them to eat plant-based, so it's okay. He's got lots of testimonials of people who reversed all kinds of diseases, a lot of autoimmune disease reversal. He really emphasizes eating the vast majority of your calories from starch, about 60 to 90%. I'm a little more lenient in the sense that I think, fruits are good. I think we got color vision because we need to see a fruit when it's ripe, and humans didn't initially have fire, so they probably ate a lot of fruits back in those days. Oh, and McDougall also emphasizes that a starch-based whole food plant diet is the best diet for everybody, including pregnant women. Okay, Ornish, he's got several versions depending on whether the goal is prevention or treatment. And he's a very famous guy, did great research with the prevention and reversal of coronary artery disease, also with telomeres, and also with low-grade prostate cancer, biopsy proven with following the PSA and going on a vegetarian diet. That's all very good stuff. The DASH diet. Now, the DASH diet is better than the SAD diet, Standard American Diet, but it's a diet like to stop hypertension, but it's kind of a joke. It's a half-assed diet, and it's sort of based on the idea, well, the public's never going to really eat a low-fat vegan diet, so we'll give them this DASH diet. No, it's bogus. Oh, here's some pictures of Dr. McDougall, and this is from that Vegan Reformation book I wrote many years ago. My kid drew this, and the joke was We made him John the Baptist McDougall. When I first saw McDougall lecturing, he'd get all excited when he was talking about milk, almost like he's foaming at the mouth, and we joked and we called him John the Baptist McDougall. Here's one of his real famous patients. My daughter used to call him Dr. McGoogle. One of his famous patients is Ruth Heidrich, and she's a lady who had metastatic breast cancer. She had significant metastatic disease, and she started running marathons, took the McDougall diet, later switched to a raw vegan diet, and she's still alive and winning all these contests. She won the triathlons, marathons, all this stuff. She went and visited Tarahumara too, and spend time with them. She's written a bunch of books. They're good. She's real good. You can watch her videos. She's got a lot of videos on the internet. She's smart, nice lady. She knows a lot. Okay, here's one point that comes up a lot. Some people say, oh, you have to supplement with fish oil or algae-based omega-3s to get your omega-3s. And no, you don't, okay? Can you remember anything from your childhood? Yeah, why can you remember it? Because you still got the same brain neurons. The brain neurons don't turn over too much. That's how we can have all these long-term memories. So you get plenty of omega-3 just from eating plant foods. And I just made this slide here to show you there's a lot of omega-3s in plant foods. And our bodies actually end up needing a lot more omega-6s. And what I'm saying is you get all you need from these plant sources. We're designed to eat plant foods, okay? Most humans in the past lived relatively landlocked. They didn't eat fish that much. It's not that easy to catch fish most of the time. And you get plenty of omega-3s in that way. Dr. McDougall has a recent lecture on that, so I've got old lectures on that subject. So he wrote a lot about it in his book Starch Solution, which I think is his best book. Popular diets comparison, Mediterranean diet. The Mediterranean diet, by the way, is just stupid, okay? One of the viewers pointed out to me, what does the Mediterranean diet forbid? Nothing, okay? It's kind of a joke, and it's like something people like to say to pretend they know what they're talking about, but it really points out that they're an idiot. Whenever somebody says Mediterranean diet, immediately it's like a sign, neon sign flashes up above their head, ignoramus when it comes to nutrition. They eat olive oil, which is terrible. They eat fish, which is terrible. Wine, cheese. No, people use Mediterranean diets as an excuse to eat whatever they want. It came out of Ansel Keys, did original research after World War II, 1940s and 50s, and where he pointed out that there were a lot of atherosclerosis, coronary artery disease risk factors, correlating with saturated fat. So people said, oh, well, we'll switch to this Mediterranean diet. But at the time he meant, like from the people of Crete, and it was largely a vegetarian diet. And, they didn't call it the Cretan diet because that doesn't sound so good. And, and I love ancient Greek culture, but if you look at a lot of the modern Greek people, they're fat. They're not that healthy, okay? They'll get offended. I know some Greek people, they're real nice, but, man, you say something bad about olive oil, they'll get offended. It goes all the way back to Odysseus and Penelope, the olive tree. Their bed was around an olive tree in the Odyssey when he returns home after 20 years in the Trojan War, okay? So anyways, let's see, what else about the Mediterranean diet? It just doesn't work for health. And like I said, it's recommended by a lot of doctors and so-called nutrition researchers, but that just means they're ignoramuses. Trust me. The more you look at the Mediterranean diet, the more you'll see that it's a joke. It's no good. Okay, paleo, Atkins diet, low-carb diet, ketogenic diet. So again, I briefly mentioned this guy, Christopher Palmer. He's a psychiatrist at Harvard, and he recommends what he calls a 4-to-1 ketogenic diet, really, really high in fat. And he says the ketogenic diet has some benefit for the brain because it was helpful for treating refractory epilepsy. But I'm just letting you know, I think it's kind of a stupid, absolutely stupid diet for a regular person to eat. Now, why is it good for epilepsy? Because it slows down your brain. Okay, my whole goal is I want to be smart. I want my brain to function at its top level. Quick, effective, clear. And so he's basically saying eat something to slow your brain down. Okay, now if you've got refractory epilepsy that doesn't respond to medications, that might be something to try before you go for craniotomy and surgery, okay? But for a regular person who wants good brain function, eating something to slow your brain down, that's stupid. And he says, Palmer says, it can maybe help with other psychiatric diseases. Maybe slowing the brain down will help somebody who has anxiety. I would say, how about stopping caffeine? That'll give you anxiety. How about improving sleep? That'll calm you down. How about minimizing MSG? Because that has an effect potentially, it is thought, like stress, increasing glutamate, monosodium glutamate at the hippocampal synapses in the limbic lobe, for example. What about cutting down on MFG, manufactured free glutamate? What about avoiding avoiding aspartame, which is also an excitotoxin? What about minimizing your dietary fat so you don't get diabetic physiology with insulin resistance, and subsequently, like I just talked about in my last lecture, you get insulin resistance in the brain. There's also glucose type 4 transporters in your brain neurons, including the hippocampus, and because of that, you can't get enough glucose into those cells when they're rapidly active, and that leads to potential problems with the mitochondria-associated membranes of the endoplasmic reticulum, sending too much calcium into the mitochondria and damaging them, and thus functioning like an excitotoxin. What about reducing your dietary sodium as a way to decrease excitotoxicity? So you see what I'm saying? You're taking, this is like, in my opinion, a stupid idea, eating more dietary fat to slow down your brain and cause insulin resistance and potentially damage brain cells, when there's all these other good options available that I just, mentioned there. So bottom line, I think it's stupid. And basically, I don't know of a single good nutrition doctor from Harvard. I'm sorry, but Harvard we are in the dark ages, the embarrassment phase of Harvard. It will be looked back upon as a disgrace. Okay, I told you, their psychiatrists are recommending drugs for kids, drug dealing to kids for money, that long-term prognosis of these attention deficit kids on drugs is really poor. Their adult psychiatrists are over-drugging patients, in my opinion, based on my opinion of reading the neuropsychopharmacology literature. Their cardiovascular physiology books don't mention Ornish. They don't mention Esselstyn. They don't mention Kempner. They don't mention any of these, Blankenhorn's research, any of this stuff. Their hypertension data pretends that nobody knows the cause of hypertension. What I'm trying to say is the Harvard textbooks, and the Ivy League textbooks, which a lot of people read and go by, they're 50 to 100 years out of date and quite frankly wrong. We know hypertension is caused by high-fat diets and high-sodium diets, okay? But they say more than 90% is simply idiopathic, okay? The old joke, the doctor's an idiot, the patient's pathetic. That's BS. It's been proven, lots and lots of patients, you reduce their dietary fat, you reduce their dietary sodium, and their pressure improves. So that's what I'm saying is, don't be too impressed when you see somebody's from Harvard, okay? It doesn't mean they know anything about nutrition, nothing at all. They routinely, like the brain trauma place in Boston was recommending a Mediterranean diet, completely stupid. Here's this guy, psychiatrist for the brain, recommending a high-fat diet, And I will bet you this guy has not read hemorrheology. He hasn't read Sloop on atherosclerosis. He doesn't know anything about excitotoxicity. Now you could say, well, I read the neurology textbook of of one of these Ivy League places, and guess what? There'll be like one paragraph on excitotoxicity under stroke, one paragraph in epilepsy, and they won't go into any of these things I'm just talking to. So I'm just saying, be aware of that, because you need to know about nutrition for yourself, and I'm giving you my 2 cents. I think stay away from this high-fat stuff. Unless you've got refractory epilepsy or some really, really rare condition and your physician has specifically recommended it and can give you a good rationale for it, I would avoid these high-fat diets as best I could. Okay, so his diet is the opposite of the kind of diets we're talking about. His diet is 80% calories from fat. That's 80% calories from fat. What type of insulin resistance do you think you're going to get with that? Only 10% carbohydrates and 10% protein. To me, that's like insane. Okay, and he says, of course, it's not nutritionally adequate. They have to supplement with a multivitamin, with potassium and magnesium supplements. Yeah, because potassium and magnesium come from plant foods, and he's giving virtually zero plant foods. He says the ketogenic diet will increase LDL cholesterol, and that's why the American Heart Association will not approve of it. He can tell whether or not they're following it because the patient will truly be in ketosis. I just let you know about that because you might hear about it elsewhere. I think that unless you have some really unusual reason, I think that diet's crazy. Okay, there was some famous movie director who had a child with refractory epilepsy, and so in that special, unique case, the keto diet was reasonable for that situation. He also mentions the person often feels quite sick the first month. Dr. Palmer says going through keto diet the first month is hell. That's a bad sign. If a diet feels like you're going through hell, that's a bad sign. People feel good usually when they eat a vegan diet. Maybe their gut will feel a little funny the first week while their gut bacteria are switching from bad bacteria to good bacteria, but they usually feel pretty good pretty fast. It's pretty routine. Pritikin, Kempner, they'll have these patients coming off their meds real fast once they go vegan. I one time had a psychiatry doctor who specifically asked me to look into it. Let's see, what else about that? No, I think it's a terrible idea for the vast majority of people. Okay, and then people say, well, what about our ancestors? They had to eat a lot of meat. No, they didn't. I mean, McDougall covers all that stuff. I'm not really interested in that topic, but that whole argument about you need meat for the brain development in humans, it's not true. Our ancestors ate a plant-based diet. When you look at it and read about it more extensively, you'll find that out to be the case. And oh yeah, these paleo high-fat diets, they might claim that it's good for diabetes. No. In the short term, you might get your blood glucose down a little bit, but they'll fail the oral glucose tolerance test because fat causes insulin resistance. It's not a good idea. Okay, the best fuel for energy is glucose. Athletes run best on glucose. Okay, SAD diet is the standard American diet. This is the make yourself fat and stupid diet. It's bad in so many ways, it's not even funny. Besides having all the processed food with the MSG and the sodium, all the dietary fat, all the omega-6 fats, it just makes people fat and sick. The average American is fat and sick, and they start becoming cognitively impaired. I've seen a lot of guys demented in their 40s, but obviously it's much more common in their 50s, and the older they get, the worse it gets. Anybody eating the SAD diet's plugging up their arteries and making themselves hypertensive and probably going to end up diabetic and or at least pre-diabetic and sick. They do not age well. Let's see, what else? A lot of oil. Okay, never eat chicken and fish. A lot of people think chicken and fish are good foods, good fats. No, they're terrible foods. Stay away from that. Okay, because I can tell you, the typical open heart surgery, messed up patient I see, cancer patient I see, they all say things like, oh no, I think my cancer and my heart disease, it's genetic. Everybody in my family has it. I eat healthy. Lots of chicken and fish and olive oil. Yeah, right, genius. That's a typical thing a sick, fat, stupid person says to me. Bad idea to eat those things. Okay, psychology of dietary failure. What I think happens to people, I went through a brief phase in my 30s where I got fat. It's because I was overworked. I was doing 2 fellowships simultaneously, writing a textbook, had a little baby at home, and because of that, and I started getting into bad habits, drinking 7 cups of coffee a day, and I got fat. And I thought it would be no big deal. After my fellowship busy year, I'll just, lose the weight. But I couldn't lose the weight for a couple of years. And I'm like, oh my God, how could this happen to me? Not to me, other people, not to me. And then I got teased by my sister-in-law. She said to me, if you know so much about nutrition, Mr. Doctor, why are you so fat? And at that point, that's where the bells went off, and I just started reading intensely about nutrition ever since that time. So anyways, but I understand the psychology of a fat person. You start getting scared. You go, oh, I guess this is just my fate. I guess I'm just fat. I can't lose the weight. What am I going to do? I have to accept this. No, you don't have to accept it. Just look around the world. You see there's lots of places where everybody's skinny, and just say, well, I'm going to eat what they eat, okay? A billion Asians, don't lie, okay? You're a rice eater. You're skinny. And just imitate them. Find another diet you like. Imitate the Tarahumara. Imitate the Yanomamo. Okay, imitate the rural Kenyans. You'll be skinny. And the proper way to think is, if they can be skinny, why can't I be skinny? I'm gonna do what they do. So, anyways, hope that was helpful.